behind it as to why these masks are beneficial right now.
Right. So the virus that causes COVID-19 is called SARS-CoV-2, and we know that it can spread by both droplet and aerosol transmission, can also stay on surfaces. But we're learning more and more about this, that the most important way that it spreads is through droplets. So those are bigger size particles that travel through the air and then settle generally about 6 feet away. This can also travel by aerosols, though, and those can travel for much longer distances on currents of air. So that's why the mask is so important, because it actually traps those particles. When you're talking, coughing, sneezing, a lot of them are going to be trapped by the mask and prevent the spread.
So what do we know now about masks that we didn't necessarily know back in February? Like I said, I think back to the Surgeon General saying, don't wear a mask, and now it's everybody wear a mask. It's confusing.
It is, but we're learning now that people can actually be shedding virus before they're symptomatic, that many people can have very mild symptoms. So you might have a little bit of a sore throat, and so could that be seasonal allergies, or is that COVID-19? So the masks are something that you can do as kind of an engineering control, so that whether you're feeling fine or just a little bit achy or a little scratchy throat, you're going to be trapping those particles. I think the other part of this is that people are learning more and more about the importance of hand hygiene, and just in terms of the general public having been educated about that and learning to do that. That's probably the biggest concern with wearing masks, is if you're touching them a lot, then you're potentially going to contaminate them. And then I'd say the third thing is about the availability of personal protective equipment. So people have really gone back and looked at the literature on the cloth masks, which were used in the 1918 influenza pandemic, and are really learning that those are a good way for the general public to protect themselves and others against the spread of SARS-CoV-2. And I think we do want to be careful about the medical grade PPE and making sure that that's available to healthcare workers, because they're going to be taking care of people who are sick with this and potentially spreading larger volumes of virus. So I think all those things played in. We want to make sure that there's not people hoarding or stockpiling the medical grade personal protective equipment. We want to make sure that people know the importance of washing their hands when they're putting these off and on. And it's a tool that's used in combination with social distancing, and really trying to limit the amount of time that you're around other people and that you're doing these errands, because all these things really work together to change the risk of transmission.
Mm-hmm. So when you're wearing a mask, you're not just protecting yourself, you're also protecting other people. So it's a twofold equation when you are wearing a mask out in public, correct?
That's exactly right. So we know from even at the turn of the 20th century with things like influenza, scarlet fever, diphtheria, that when people wore these masks, the infection rates in their patients actually dropped pretty significantly, anywhere from 25 to 50%. That's wearing cloth masks with the outcome of an infection in the patient. There have been other studies that have looked at isolation masks worn by healthcare workers with endpoints of things like clinical respiratory illness, influenza-like illness, and lab-confirmed illness. And just with the endpoint of self-reported clinical respiratory illness, the isolation masks can decrease that risk anywhere between 40 and 60% among healthcare workers.
How come the science has changed so much within just the past couple of months? Is it just because we're rapidly studying this to try to learn more?
Yeah, well, a lot of the information that we have is really extrapolated from other viruses. There are people who are doing environmental sampling for the SARS-CoV. This is the new one that's causing COVID-19. But most of the data that we have comes from the SARS that was first introduced in 2002, where there was global spread of that and people were studying that among healthcare workers. Then there are other studies that look at the influenza virus and other viruses that circulate every year.
Interesting, okay. What about reusing the masks, washing the masks, especially with the availability of PPE? You know, I think it's unrealistic to think that most of us would have a mask and be able to change it out every time we're out in public.
That's exactly right. So what we're recommending is that people wash their masks daily, so use one mask a day for the cloth masks. In the hospital, what we're doing with our isolation masks is we're also trying to use one mask a day. Now, if your mask gets really wet or visibly soiled, then you want to change it out, and that's what we're advising our healthcare workers here in the hospital.
What about, are different masks better than others? We obviously know the N95 is great, but here, this one around my ears that I keep adjusting, or we have the cloth mask here, you had another cloth mask, you're wearing a different kind. What are we looking at? How much protection do all these different masks offer?
Right. Well, the N95 is the one that we're using for the critically ill patients where we know there are aerosols that are being generated. So those are people who are on a ventilator, who are getting aerosol generating treatments on high flow oxygen. So that's the one that's going to filter 95% of the little tiny particles that travel longer distances in air. So that's one that healthcare workers really need when they're doing those aerosol generating procedures. For the rest of us, these isolation masks and the cloth masks are going to be very protective. So anywhere between 70 and 85% of the particles are going to be prevented from spreading. And it's actually interesting that even these ones that become aerosolized, the thinking is that when they first come out of humans, they're encased in wet droplets, and those probably actually stick to these isolation masks and the cloth masks better. So there's even some thinking that maybe these impact the aerosol generation because those particles may be trapped on the surface of the masks.
But there's no difference between the mask that you're wearing versus the mask that I'm wearing, just from an average person, everyday perspective.
There's not a lot of science to actually, definitively compare those head to head. There aren't a lot of studies to be able to say that. But in terms of the outcomes that have been studied that look at these endpoints of transmission of infection and movement of particles when these are studied separately, they do seem to be roughly comparable. We are wearing these medical grade isolation masks in the hospital because the studies among hospitalized people and healthcare workers have been done in that setting.
Right. But as an average person overall, in terms of my list of things to worry about,
right,
just wearing a mask, I don't necessarily need to worry about the type.
That's right. A cloth mask is good. The goodness of fit is really important. So you do want it to be tighter. You want it to cover your nose and your mouth. That's going to keep it to be very effective. So people wearing it kind of under the chin or not covering their nose, that's where you're going to decrease the effectiveness of the mask. If it gets wet, it's not going to be as effective. The tightness of the weave is important as well. So kind of a t-shirt-like kind of consistency of fabric is a good fabric to have. So those are all things that are going to be very important in terms of the effectiveness of the mask.
Yeah, and let's talk a little bit more about fit. Like I said, I think I've worn this one a couple of times now. I've washed it a couple of times, and I think it's stretched, to be honest with you, based on how many times I'm adjusting it. I mean, how effective is this if I'm adjusting it that many times? Clearly, I need to go out and probably get something new. So what do you want people to know about the effectiveness, about the fit? If it is dropping below your nose a number of times, how much effectiveness does it lose?
Yeah, well, one thing you want to be careful about when you're touching it a lot is the fact that you could contaminate it with other particles that are on your hands. So you want to make sure that you're doing good hand hygiene and trying not to touch your face, even with the mask on. Because if you're touching your face a lot and have a false sense of security about wearing the mask and still contaminating it that way, that actually might be worse. If things are getting loose around the nose, then it might be time to get something that's a little snugger or to try to adjust it with the straps and just have it make a tighter fit. But that does happen with masks over time. Some people, when they're sewing them, will put a pipe cleaner in that top, and then you can bend it and kind of mold it around your nose, and that will help with the goodness of fit as well.
Yeah, I've seen that. That looks like it'd be pretty effective.
Yeah.
And then what about covering your nose and your mouth? Those are the two places that we've really talked about the fact that need to be covered in order for the mask to be effective. There's been a little bit of talk about the eyes with the coronavirus.
Right.
Are there any concerns with not having your eyes covered? Should people start to think about something that could cover their eyes? What are your thoughts on that?
Yeah, so we are advising eye protection for our healthcare workers, and really that comes out of the experience with the SARS virus that emerged in 2002, when people who were taking care of hospitalized patients still had some infections, even wearing the N95s. Now, the things that are hard to control for are how you took it off It's very, very important to take things off in a certain order and do hand hygiene with that. But certainly with the SARS virus in 2002, when they introduced the eye protection, the rates of infection among healthcare workers dropped dramatically. And this virus resembles the SARS virus from 2002, and so that's where we're extrapolating that and basing that recommendation that healthcare workers wear eye protection.
And then I think just what you had said with the 75 to 80% of the droplets being contained within a mask kind of really hits home for me, because this is uncomfortable. This isn't fun to wear. It's not something, contrary to popular belief, it's not something that anyone is enjoying right now. But 75 to 80%, that's a pretty good percentage in terms of effectiveness.
That's right. That's right. And I can't stress how important this is, that we continue to try to keep the numbers of infections down. People get very, very sick with this. I've taken care of teenagers who are critically ill. We've been very, very fortunate. We have amazing ICU doctors at St. Louis Children's Hospital. We've had 100% survival thus far, but these people are very, very sick. So that's the first thing. We don't want anybody to get sick. But the other part of this is, if you do get sick, I do think that we're going to have a better chance at having the very best outcomes if we're not overwhelming the healthcare system. When you have a big ante room to take off and put on your personal protective equipment, when you have enough of it, when you have somebody standing right there to take it off and help you to take it off safely when you're coming out of a room with somebody who has COVID-19, that's going to be a much, much safer situation. Patients are going to get great care because healthcare workers aren't distracted, and healthcare workers are going to stay healthy, and our community is going to stay healthier. So it's critically important that people continue to wear these masks, continue to social distance as we start to open up our businesses and other community venues.
Yeah. What would you say to someone who, we've seen some people just really not wanting to wear a mask when they go to a place like the grocery store? What would you say to that person if you happen to be standing in line with them?
Yeah, I would say, for your protection and my protection, you really should be wearing a mask. And I've really been impressed with the businesses that are asking people to wear masks. And really enforcing that, and people who are requiring that people wear masks to come into their places of business. It is for everyone's protection. We are all in this together. We all have to take care of each other, and we will get through this, and we will get through this with better survival if everybody is wearing a mask.
Yeah. And let's talk about that with restaurants and bars and businesses, because I think that they have done a wonderful job of telling people, you need to wear a mask when you come inside. But if we were going to go, I did a story at ITAP last week, if we're going to sit down and have a beer, you have to remove the mask. So
Right,
I think
right.
people might be a little hesitant or say, well, what's the point of me wearing it for the 5 minutes while I walk inside and get seated? Can you speak to that a little bit?
Yeah, well, we've even seen outbreaks among people in choirs who are singing. There was that situation on the West Coast. And so, if people are singing or forcefully sneezing, that could be a spreading event. So the more time you're wearing the mask, the better off the rest of the people around you are going to be, the better off that you're going to be. This is not an on-off. It's definitely a duration and an amount of exposure. And so anything we can do to decrease that risk is going to help each other.
Yeah. And kind of touching on that, Dr. Page has said repeatedly, and I think Mayor Cruzen has echoed the same thing, that wearing masks is going to be crucial to the recovery of St. Louis. You spoke about that a little bit, but I just want to have you kind of speak about that again, because it's one thing to just tell someone this is crucial to the recovery. It's another thing for them to understand exactly why.
Right. No, we have been incredibly fortunate here in terms of the statistical modeling that's been present in terms of what could have happened with this first wave versus what did happen. And many of the intensive care units around the area did get very, very full. There were areas being opened up. Patients moved around so that we could create more capacity. And we were able to keep everybody in a traditional ICU bed with a traditional ventilator. Everybody who got dialysis, who needed it, got it. But if we had had twice as many people, that would have been very, very difficult to achieve. And so it's just vitally important that we continue to try to decrease the spread.
We're not out of the woods.
we're not out of the woods. Certainly with influenza in 1918, there was a peak in the spring and a peak again in the fall. We saw that with H1N1 back in 2009 and 2010. We had a little peak in April, and then it came back with a vengeance in September and October. We don't yet have a vaccine. People are working really, really hard on that. But H1N1 ended because we had a vaccine. So this is going to be a longer haul for us. And so we just do need to get used to this new behavior of wearing this mask so that we can start to open up and do essential business in a very, very safe way.
Yeah. So is that what you would urge people in terms of the mask? It may not be fun, but get used to it because we're going to have this for the foreseeable future. I mean, I think about my mother who's over 60 who complains that it itches her face. But if this is what we're going to be looking at for the next 6-8 months, a year or two from now, it is going to be something that people are going to have to adjust to.
Right. That's exactly right. Right.
Interesting.
Mm-hmm.
Are there any other things that you have seen out in public, or maybe ways that people are wearing them, or different things that you have maybe noticed that have been helpful that you want to share with anyone about wearing masks? You mentioned the pipe cleaner, which clearly I could use today.
Well, some things I've seen, some of our nurses in our intensive care unit actually are wearing headbands that have little buttons on them so that they can hook their masks around the buttons. Some people are putting little pieces of foam behind the straps so that they're not pressing on your ear and not causing sores that way. So that's something I've seen people do that might help with the comfort if you're going to be wearing it for an extended period of time. And then I'm also noticing that people are kind of coordinating their masks, that it's almost become a fashion accessory so that they're wearing the same color mask that their outfit is that day.
Do you think that the masks, I understand that this is going to be the new normal, at least until there is a vaccine, but you see in other countries masks being much more common than you do in the United States. Is this something that you think that we're going to shift towards as a society a little bit as people become more aware of personal hygiene and the spread of germs?
I think that's a little bit hard to say. I'm not sure how that practice has evolved in other countries, except that I think population density probably plays a role. And then proximity to wet markets and things like that, where we know that there are animals that are alive in close proximity to lots of different people. And so this may be a behavior that's really developed in response to, just knowing and observing that viruses can emerge that way and can jump from animals to humans that way. So people may have just recognized this over time and started to wear masks in countries where there just are more people and where they have had the experience of having new viruses emerge and be amongst them before they were even recognized.
Right. What about kids? We're going to see the zoo open up, and I believe that the zoo has said anyone over the age of 9 has to wear a mask. What are the standards for effectiveness with kids? What's the science behind that? I can see some parents really wanting their kids to wear the mask, and then other parents thinking, I don't want my kid to have to deal with that.
Right. Well, we know that older kids can definitely generate aerosols and cough, and certainly with the experience with tuberculosis in general, as a rule of thumb, we think about kids under the age of 9 as not being able to cough so forcefully and generate those big aerosols. And so that's the science behind that. But it is really important for older children to wear the masks, teenagers to wear the masks, because they can spread this by droplets and aerosols. And the recommendations really vary. Some of the information from the CDC recommends that people who are age 2 and older wear masks. I'm seeing some groups use age 3 and older. We do have to take into consideration the developmental stage of the child. And if you have a child who's going to be touching their face a lot, then that might actually be a riskier situation than not wearing the mask. So at the age of 9, though, we'd expect that most kids would be able to developmentally keep a mask on, not touch it all the time. And then those are the kids who are older than 9 who are probably going to be generating deeper coughs and more forceful aerosols.
And what's the difference between a droplet and an aerosol? That might be getting too specific, but you've just used both words, so I'm wondering how interchangeable they are.
Yeah, well, people generally think about the size of the particle, so a droplet is between 5 and 10 microns. And then an aerosol is smaller than that. But it's also the way that they physically behave as particles. The droplets are larger, and they generally tend to drop after about 6 feet, whereas the aerosols are tinier and they can travel for longer distances on currents of air. So things that are spread in that manner include things like chickenpox, measles, tuberculosis. Those are the things that are more highly contagious, and that, we use different airflow when we put people in the hospital for. We use the N95s for those kinds of things as well, different numbers of air exchanges for the rooms. So aerosols are more infectious because they can travel for longer distances.
And then one of my last questions, I know with all of the restaurants and the availability of PPE, it is getting better with there is more of a prevalence of cloth masks at this point, but I think that there is still a supply issue in terms of restaurants getting everything that they need. What should people be looking out for when they go out to buy these masks, when they're looking online to purchase products, even looking, for a video that tells me, how do I make this mask? What's legitimate, what's not?
Yes, so I think the credible sources of information are the Centers for Disease Control and Prevention, the World Health Organization, the American Academy of Pediatrics, and certainly the guidance that we put out through Washington University and BJC is all based on those sources of information. So I think that's what you want to be looking for when you're thinking about how to make a mask and what to purchase.
Steve, is there anything I missed?
I have more of a curiosity question. I don't know if it's necessarily for this interview, but I've seen my son's dentist, and then I just saw some other person, I don't know who they were, actually had 2 masks on. So they had what looked like the N95 mask. One was the mask here with the surgical mask, and then the N95 mask, and then it was the other way around for the other person.
Yeah.
What's the effectiveness and what's the reason behind that?
Yeah, that's interesting because that's certainly been a topic of discussion. So for the dentists, a lot of what they're doing are aerosol generating procedures because they have those high-powered things that they're squirting air and squirting fluid. And so they do need to wear N95s when they're practicing. There are some people who have been covering the N95s with another mask. We actually don't recommend that because that probably interferes with the filtration ability. I think people might do it to try to avoid the N95 becoming wet or soiled, because when that happens, then people will discard it. So I think what it is an effort to conserve PPE. But the thing that we're doing in the hospital is that we have a face shield that's really protecting the N95. So you're protecting your eyes and your mask at the same time. But I have seen people do that, but that's not a practice that we're recommending.
Yeah.
And the face shield acts more as a direct spray.
Right.
Rather than just in the atmosphere where you would breathe it in. That's where the filter of the mask itself comes in.
That's exactly right. So the N95 is protecting you from the aerosols that are in the air, and then the face shield is protecting from those big splashes and the droplets, and that's providing the eye protection as well. And the face shields that we're using in the medical profession are the ones that come from the top down, not the masks that have the face shields attached, because that leaves a gap around the sides of your eyes and at the top.
So for our purposes, the average person that is sitting on their couch that is slowly starting to return to normal life, what is the number one thing that they should be concerned about right now in terms of wearing a mask?
Yeah, so what they want to do is put a mask on when they're going out. They want to avoid going out themselves if they're feeling sick. And really think carefully about the number of times that you need to go out and try to do things in the most efficient way possible so that you're minimizing the amount of time that you're outside and around other people. And you want to maintain that social distancing. You want to do 6 feet apart.
What about if I'm just taking out my dog and I'm going to be 6 feet away from people? Do I have to wear a mask?
I think it depends on your neighborhood and your population density. And are you likely to be stopping and talking to people? Are you in, an apartment building where you have lots of people that you might be running into, and it's going to be, impossible to maintain a great distance from people? So I would say that people should, in general, wear masks.
Anything else that you would like to add, or anything else that I missed? I know I asked a lot.
I think the other thing I would like to say is that if people are sick and they need health care, they should come and get health care. We definitely want you to use your usual rule of thumb. If your child is having trouble breathing, we want you to come to the emergency room. If they're having a prolonged fever, we want you to call your pediatrician and talk through that and figure out what the next steps are. It is safe to come and get health care. We have PPE. We are doing social distancing in the waiting rooms. We've even changed the number of chairs and the way the chairs are configured. We are working to get people back in rooms really quickly. We're doing registration in cars so that people aren't congregating up at a desk in line. But it's very, very important for both adults and children that you get your regular health care, your maintenance health care, and that if you're sick, you seek medical advice. And if the recommendation is to come in and see your doctor or to come to the hospital, it is safe to do so. Please do so.
I thought of one other thing. What about when exercising?
Yeah. Well, I think definitely you want to be socially distant when you're exercising. And if you would be in a group setting, you would want to wear your mask as well.
Interesting. So even if you're sweating, it can still be effective in terms of preventing that disease.
Absolutely. Yeah.
Wow, that's something that I wouldn't necessarily think of.
Yeah.
All right. Anything else, Carly?